Now, one of the many questions being asked is what will happen after countries slowly emerge from lockdowns and whether that could lead to a second wave of infections. That is exactly what is happening in South Korea, one of the countries most widely praised for its initial response to the pandemic. Authorities there have reported a spike in new cases just as social distancing rules were eased, forcing the closure of all clubs and bars in the capital, Seoul. Reged Ahmad reports.
The normally popular nightclub scene in Seoul closed, with signs explaining why. South Korea had just started easing its social distancing rules in March after an impressive effort to contain the coronavirus when a spike in case numbers was registered.
The number of patients related to Itaewon clubs is 54. We are continuously tracing additional contacts and sources.
It's prompted the South Korean president to warn the public to brace for a second wave of infections.
The
infection cluster, which recently occurred in entertainment facilities, has raised awareness that, even during the stabilization phase, similar situations can arise again anytime and anywhere in an enclosed, crowded space. It's not over until it's over.
Those are words which may echo in people's ears as governments watch progress in South Korea closely. That's because it's been one of the countries at the forefront of the trace, test and treat policy, successfully getting on top of its pandemic and keeping case numbers low, all without a total lockdown. This setback will be a disappointing reminder of the challenge in keeping things that way.
People felt relaxed because the situation was getting better, but after the outbreaks at nightclubs in Itaewon, I thought we shouldn't put our mind at ease because we don't know when and where the virus will spread.
The outbreaks at nightclubs suddenly occurred in my neighbourhood, so I'm very scared and disappointed.
For other countries still in the middle of strict lockdowns or just at the start of easing social distancing, this spike in cases could be an uncomfortable glimpse into the future and an example of the lessons yet to be learned in fighting the COVID-19 pandemic. Reged Ahmad, BBC News.